Thyroid problems affect the way we look, feel, and even think. And sometimes thyroid problems may not be diagnosed because of something called low T3 syndrome. Dr. Frank Lanzisera from the Lanzisera Center is here to tell us more about this. Welcome back, doctor.
Good morning.
Low T3 syndrome, what is it?
So T3 is the active thyroid hormone that's produced by the thyroid gland, but many times it's not tested on a conventional blood test. Most of the time, TSH and the T4 inactive hormone are tested. Many times, TSH and T4 are normal, but if the T3 is not tested, it could be low, and that's the reason for the patient's symptoms.
And is it common for the T3 to be low, and is there any particular type of person that experiences this more than others?
Well, one of the clues is brain symptoms. So if you have brain fog, focus trouble, concentration trouble, anxiety, depression, that's a sign of low T3.
Why don't all doctors check for T3?
Well, typically it's not considered part of the standard insurance exam, so many times it's not tested. It's the active hormone that has to get into your cells so you don't have fatigue, weight gain, lethargy, memory problems, etc.
So if you take the test and you find that the T3 is low, what can you do about it?
Well, now we have to find out why it is low.
Right.
So it could be low because of inflammation in the body, because T4 gets converted to T3 in your intestine and liver. And if there's inflammation in those organs, it can hamper the conversion. It could also be because you have too much estrogen. You know, a lot of women think estrogen is a good thing, but too much of it can block the conversion of T4 to T3. And it can also block the amount of T3 that gets into the cells.
All right, so we've determined that this is what's happening. So now what? How do we fix all this?
Well, we have to look for the reasons for the low T3. And like I said, it could be inflammation, which could be due to food allergies.
Okay, so there we go down another path then, right?
That's right.
So we found out there's inflammation in the body. Then what? Another series of tests to find out what you're sensitive to?
Right, so what's causing the inflammation? That could be food allergies, leaky gut syndrome. It could be a viral infection like chronic Epstein-Barr virus, cytomegalovirus. Those chronic viral infections can perpetuate inflammation and cause low T3.
So at that point, is it advisable to change your whole lifestyle, or do you pop a pill, or do you take a supplement? What do you do?
Well, it's lifestyle. So we have to figure out the causes. Inflammation, we have to adjust the diet. If there's a chronic viral infection, certain foods will cause certain viruses to replicate if they're high in certain amino acids. So we might steer the patient towards foods that can hamper that virus replication.
It sounds like you're going down a path of quite a bit of testing to get to the root of the matter. How quickly can you see a turnaround in people, and how fast can they start noticing a difference in their lives?
Within a month. Once we figure out the pieces of the puzzle, symptoms start to improve. And of course, the blood tests will show the T3 levels start coming up.
And once you start seeing those going up, you should start seeing a marked improvement in your overall health, right?
That's right.
Now, you've got 2 more thyroid seminars coming up, right?
That's right.
What happens at those?
So I go through the thyroid pathway and the different pieces of the puzzle explaining T3 syndrome. And we have those seminars twice monthly in the office.
Good stuff. Dr. Lanzisera, thank you very much for coming in today. I'm sure a lot of people are thinking, this is me, I need some help here. The information for Dr. Lanzisera's next seminar is on your screen right now. For more information, go to thyroidtampa.com or call 813-253-2333. Daytime will be right back. Thank you.
Thank you.